before we start?
1 hour.
Okay.
Okay. Let's see. Is it working? Mm-hmm. Okay. So, yep. Okay. All right. So Nina says we're live. All right. Thanks everyone for joining us today. This is the second panel of 3 for the Danotsav Week, Joy of Giving Week in India. The first was about the portrayal of mental health in the media, and we had such a lively discussion from that. And I'm so excited today to talk a bit more about when it comes to treatment of mental health, what are the avenues? I think that globally, the world is recognizing mental health as something that is so critical, so important. It's something that we all have. We all have mental health. At any point in time, we are all at a different point on the mental health spectrum. Even if you don't have a mental illness, as a human, part of your experience, you will experience mental distress at some point. And so recognizing what are the treatment options, what are the things that we can do to not only help ourselves, but to help our loved ones and our neighbors to really thrive and to create a community is so important to me and to, I think, everyone else on this panel today. So, I can go on and on about this, but I think that I'm very honored and delighted today with the 4 individuals that we have. And I'll just briefly introduce them, but I'll give them a bit of time to discuss their own background as well. First off, we have Havovi Hyderabadwalla. She completed her master's in forensic psychology from University of York in the UK, prior to which she received a clinical psychology degree from SNDT University in Mumbai. And she's the co-founder of Mind Mandala, which she will speak a bit more about, but has been extensively working in the rehabilitation field with patients not only in hospitals and the clinic, but also in prisons over the past decade. And so it's a very fascinating area. Again, mental health has no boundaries, so it affects everyone regardless of where they are. Next, we have Dr. Anjali Chhabria. She's, I think many of you know, one of India's leading psychiatrists, psychotherapists. She's also the author of the book, Death is Not the Answer, Understanding Suicide and the Ways to Prevent It. She's been contributing to the mental health field for at least the last 2.5 decades. Runs Mind Temple. It's a mental health center providing a very unique, holistic approach to mental health care based in Mumbai. She's trained as a past life regression therapist, hypnotherapist, and takes a very unique, innovative way to treating patients. And so I'm very delighted to have her joining us today as well. Next, we have Manoj Chandran, I would say a dear friend I've known for a number of years now. He's the founding CEO of the White Swan Foundation. And he comes with a very unique background. He's not a clinician, but he's a part of the treatment journey for many, many patients and caregivers. And so I found it important to have him here. He brings over 25 years of experience in journalism, communications, marketing, strategy, leadership. He's been on the leadership membership of Ashoka Innovators for the Public. He's also held corporate marketing functions at IT companies, and as a journalist has spent time with the Times of India and many more outlets. So he brings a very unique voice that we need in terms of how do we actually scale knowledge about mental health to the public. So with that, I'll introduce myself and Pragya. We're both from the Minds Foundation. Pragya is a young, blossoming clinical psychologist based out of Mumbai. She's also the Mumbai program director for the Minds Foundation, has been with us since 2015. She also works at the D'Souza Foundation based in Mumbai, is an associate editor for the Indian Journal of Mental Health. She has over 100 national and international publications, She also studied. She teaches actually as an assistant professor in S&DT University, and is a trustee of many other mental health organizations, and is a founding member of One Future Collective. In addition to all of this, and so with all of that, she does still see patients on a very regular basis and keeps up with her practice. And lastly, I'm Dr. Raghu Appasani. I'm tuning in from Los Angeles, California. I'm a psychiatrist based here and founder and CEO of the Minds Foundation. It's a nonprofit organization. Our vision is quite simple, and the solution is quite simple. The vision is, how do we create a world in which anyone, anywhere can access the mental health resources they deserve? And the solution is, we educate everyone, whether they are the individual patient or the caregiver or the politician. You educate them to bring back that empathy, bring back that compassion, and create a community that is supportive, where people can actually then go and seek the help they deserve without feeling shame. And that's what it comes down to. It takes a lot, obviously, I'm simplifying, but if we think about it like that, the solutions we can think about can be quite tangible. So with that, I'll start, Manoj, with you. The first question I just want to pose here is just, in a minute or two, can you discuss a little bit about your own journey into mental health? What sort of things, led to it, whether it was growing up, your own mental health journey, careers? What was the spark that really ignited it for you?
Thank you, Raghu. And I've never had been posed this question. So this is a unique one, I would say, on mental health. But this is a good one to reflect on. So if I have to look at my upbringing or my kind of early days, it would be a little bit of a journey into history, because it would be about 45, 50 years back, when mental health is not a word that you would so frequently hear in a conversation. So the only exposure to mental health probably would be about some stories, childhood stories, or some novel that you're reading. You will find some kind of instances on mental health and madness. Actually, the word we would have come across more often would be madness or mad, than mental health, in its formal way. So that's how we would have probably had brushes with this whole thing. And of course, as a child, where pressure was not very high. I mean, you didn't have even TV at home, and so you wouldn't really be thinking about stresses or things like that, and you wouldn't be exposed to things, aspects like this. So it was only after college. In fact, during the college time, while I was studying science, where I took interest in psychology and was reading a lot on psychology on my own interest, and got to know about what this whole thing about brain was actually. And things paused there, continued my journey in a completely different direction, and this whole career was largely about communication for me. It's about how well can you communicate a certain message across to people. And I worked with a lot of people. And one of the places that I worked was an IT company called Mindtree, and I was roped in to handle the corporate marketing function there at Mindtree. And I was working very closely with one of the co-founders of Mindtree, Subrata Bagchi. And Subrata had this idea about doing something in mental health care, which could possibly be about knowledge, because he clearly felt, and he has had personal kind of experience as a caregiver in mental health care space. He felt that we really need to empower people with the knowledge space. And after having worked in Ashoka, he then dropped this idea that why don't we look at doing some research to understand how can knowledge really change the way the fundamental issues and challenges of mental health care exist. And I did research for 6 months with a lot of stakeholders of mental health, and found that, yes, this is what we could do. And then with that was just like seed for an organization called White Swan Foundation, which Subrata and Sushmita, his wife, continue to support today. And over the last 7 years, it's been mental health and mental health care, and a whole new, very innovative journey that I've led in mental health care. So we will talk about it as we get into the conversation, but little serendipity, little bit of interest, but I think the common element has been communication. and changing the mindset of people. And mental health was as a very kind of new area which required a lot of work, and said this is very interesting because it's an opportunity for us to bring in huge change. And I want to work in that.
Thank you, Manoj. That's a very unique life path, I would say. And it's really great to have you in the mental health space with all of that background and that experience. So the same question to Dr. Anjali.
So, my interest in mental health has actually been ever since I was a kid, where I was quite intrigued about why people behaved in different manners, even in a similar situation. So I remember, I think I was probably a 6-year old, and I had this neighbor who had OCD, and I still remember as a kid, all kids would gather around him, and he used to keep locking the door and counting the lock 50 times, and the other kids would purposely interrupt him when he was counting 34 or 35, and then we would all run away from there. And I kept wondering, I said, what happens to this man? Why is he doing this? And of course, that was probably the first seed of interest. And of course, during my MBBS days, while we were allowed to experiment with different subjects, I realized that my first love was and is psychiatry, because what is it that makes people behave differently? And how is it that we can get them to function, you know, of course, sometimes with medication, sometimes without medication? What is it in the brain circuits? What is it in their circuits? And each person is so interesting. Each person is so different. Each person has his or her unique story, So I guess that's what, of course, there was a lot of stigma associated with psychiatry, even when I wanted to become a psychiatrist. And I remember an entire conference going on in my house where all the doctors that my parents knew came to tell them why I should not become a psychiatrist, how nobody would marry me, how after 20 years you don't know who's the psychiatrist and who's the patient. That was the kind of stigma I'm talking about in 1985. But I'm so glad that, of course, my parents said, no, just go ahead and do what you want. Because, even at that time, they believed that if you love what you do, you're never working, So there's been no looking back. And, it's like how you take an entire village to raise a child. I think it takes a whole lot of professionals, caregivers to help one person who is probably, not on the right track. But the joy of getting him or her back, the joy of, I just love it when a person comes to me and says, I've been to 7 mental health professionals and I'm not happy. And I like to say that. I said, okay, I hope you're with the last, and then to see them 10 years later, 20 years later, come and meet you somewhere and saying, I'm so glad I met you. I think that just makes me feel so happy. I don't think anything can replace that.
So everything you said is resonates with me so much. I think we have lots of offline discussions to take after this. But you mentioned 1985, telling your family you want to be a psychiatrist. I finished my
Right.
MD in 2018, and I told my family I want to be a psychiatrist in the U.S. And that stigma was there. I think
Right.
up till maybe about a year and a half ago, when mental health was really showing up in the news, I think my father maybe still had a delusion that I was a surgeon. But the thing is, they're quite supportive now because people are recognizing the importance of it. And so it's really great to have leadership like you in the space for us to look up to and see how you work with patients and your approach to it and how it is actually unique. And it's not the stereotypical approach to psychiatry and to psychology that is often misrepresented in media. So Thank you for being here. Next, I'll go to Havovi. Same question to you as well. What is your journey into mental health? What was that spark, if you can think back, that attracted you?
Okay, so I think it started with a little girl being very, very unwell, and she got the support of a lot of people around her, her family, me. So I grew up in a very, very nurturing environment. I used to be a very, very sick child, and I was never meant to feel bad about it. There was no shame, there was no guilt. There was a lot of growth, there was a lot of resilience, there was a lot of strength, and it gifted me superpowers, which I eventually converted in my life to basically, I knew I wanted to take care of people. I initially wanted to be a physiotherapist. And I remember not getting the marks for it. And I said, no, I'm going to do this on my own. And I am going to end up helping people and I'll figure it out. And I even remember being on the school playground and not being able to play. So what I would do is like, I would talk to people, and that really really helped me. That really sort of improved my communication skill. I didn't even know where I was going, what I was doing, how what was happening. A lot of people ended up telling me I'm a very, I'm a good people person. I speak well, I'm able to communicate. And eventually I just feel that one led to sort of another, and the whole spark of helping people was still there, and I knew that I could make a difference in this manner, talking to people, helping them out. I also come from a family of teachers, so I really believe in education a lot, that it can change somebody's life. And that's a very, very strong part in me. And even at Mind Mandela, I think we sort of started off with the whole, uh, with the thought of that instead of going out there and just helping people one by one, why not create an army of people who can do this on a daily basis as well? So there is that's basically where it all started for me. That I've always wanted to help people, and eventually that's what happened.
Raghu, could you unmute
Raghu.
yourself?
Thank you. So, thank you for sharing that. And I think for a lot of us, it's our own personal stories
Yes.
and life experiences that really attract us to this field. And even with Minds Foundation, when I founded it, 10 years ago when I was 20, the folks that got involved were really on a volunteer basis. It was the personal experience. They had someone they knew. They had their own experience going through something that really drove them. And still, that's a lot of the passion that drives those that work with us and our partners, like Manoj at White Swan. So, really thank you for sharing that. So, Pragya, we come to you. I think the youngest member on the panel here. I know
Yeah.
you've been in the mental health space for quite some time, though, given your life, given your age. So, tell us, what is it that attracted you, but what is it that keeps you still in the space?
Yeah, I think my journey is something that is still continuing to grow. And if I look back, like how Manoj said, that mental health was never a word 45 to 50 years back. But I think even when I was a child, like nobody really said the word mental health out loud. But when I look back, where I learned the importance of mental health is, I think I would say my family, because when I look back and when I was thinking that there was so much of space to talk about emotions, there was so much of space to trust, there was so much of space to cry, and all of these things I think become so important, because when I was training to become a clinician, when I was training to become a mental health professional, I think I was also very, very blessed with a lot of supportive teachers. And when I started working, I also realized how important these things were. So I think what really keeps me in the journey till date is that being able to, I think, carry my positive experiences and not just share, but I think translate into my training, into my practice, and reach out to as many people as I can and help them realize that their mental health is also as important. And it's also very powerful to know that when you are able to be in a sound state of mental health, it also empowers you to take care of the mental health of people around you. So I think that's where I am still building on my journey from here.
Thank you so much, Pragya. So very unique stories, and I think what really brings us all together is that we have a story, and we're interested in helping others with their own story and journey. So with that, I think that, as we mentioned, the mental health is all over the news. It's the pandemic that has now become uncovered due to COVID. There's unfortunately suicides on the rise. There's depression and anxiety on the rise. There's domestic violence, substance use on the rise. It might seem overwhelming and like we're losing in the battle, but there's many of us, like those of you on this panel and others joining, and even non-clinicians as well. Manoj was one of the first, but there's others joining now in the space to try to figure out a solution for this. So with that, I think that, Havovi, you mentioned your family being teachers. And for me, growing up, the one thing that my family told me was that education is power, and it's the key to growth. And that's it is, and that's the foundation of a lot of what we do at Minds. But as this mental health space and wellness space, which often gets tied together, continues to grow, it can be quite difficult for someone to navigate where to seek help, who to go for help. Is the Reiki healer sufficient? Is yoga sufficient? Is a life coach sufficient? What is a life coach? What is a therapist? What is a psychiatrist? What's a psychologist? What are the differences between this? It's often very challenging to figure that out. And so I think I would like to spend a little bit of time really making the clear distinctions here and the roles of these different individuals, because they all share a certain role. The last thing I will add before I pose this question out to all of you is that in India specifically, and in many other cultures and communities, even in the Native American communities in the US, healers and traditional healers and faith healers have such a key role. They are so trusted that, in my opinion, we do need to work with them to some level. And they have a very strong role. We've done research that we've published looking at their perceptions of mental health, and they do get some level, actually quite a bit of training over generations. That's very supportive. So how do we define the different roles of all of these individuals that I mentioned? And how can we work together better to create an environment of treatment? I think Manoj, maybe it'll be great to get you to start with this at the first point of contact for many individuals that you see.
Sure, Raghu. So let me just try and put the lay of the land out there, and then maybe you could look at the solution part also, because this is one of the fundamental issues that really grapples particularly mental health issue. This is very uniquely placed in the healthcare space in general, because at one end, if you look at it from a certain perspective, it looks like it is a supplier's market, which means there are more service providers than the demand, because demand is not there yet. While the need is very high, but even among those who really need it, they're not demanding for services. So yet, while we know that there is enough kind of supplies, then the other problem here is it depends on which part of the geography you are living in or you're seeking access to services. So if you are in an urban space, you probably are in a better, more accessible space, because you know that large concentration of service providers are in that area. But if you move a little away, I'm in Bangalore, I know that if I just move away 25 kilometers from the city, suddenly there's a huge dip in access to service providers. They'll all have to come to the city to get access to particularly services like counselors, therapists, and psychologists. Psychiatrists, maybe in some government outfit, you find some psychiatrists there. So largely in India today, if you look, unfortunately, it is about both luck and a lot of trial and error. Like Dr. Anjali was pointing out about the whole narrative that I've tried many mental health experts and I've finally come to you. This is also one of the reality we really need to address and understand. How do we find a solution to what a lot of experimentations happen? And we need to really be able to see that not only are we educating the potential market, potential service customers, but we also are educating the service providers so that they play a slightly bigger role in creating market. And I'm talking a lot of marketing words here, but at the end of the day, maybe there are some good practices that we could probably borrow from the marketing space or the corporate space to say that mental health care from a services perspective, access to service perspective must change. And it really needs to become a demand-driven market, which means that it's because only when we begin to get people to demand services, then we will see both supply and quality happen. Today, we don't even talk about quality because supply itself is so short. So both will have to be addressed and let the market be of those people who are customers. And that shift will have to happen for us.
Yeah, thank you, Manoj, for that. I think the demand is definitely increasing, I will say, but I think that you're right. There needs to be a little bit of alignment there. Dr. Anjali, I feel that you might want to respond on this. And I would also love for you specifically, you brought up a story of the individual who comes to you after trying many other avenues. And, I've dealt with this as well. What is that journey for an individual? What have they gone through? Maybe you can incorporate that in as well.
So, there are two things that I would like to address here is one is the role of faith healers, all over the world, even in our country. Now, what I normally see is that the doctors may put them down and and conversely, the faith healers put the doctors down. And that is when the stigma increases, the problem increases. But honestly, what I did was, almost 20 years ago, in fact, I had this conference on spirituality and mental health in 2001, and what I did was bring everybody to the same platform. And I've been doing that since then because we cannot survive alone, especially in a country like India. There are only 5,000 psychiatrists. How are we going to cater to the entire country? We need to work together. Where I feel the faith healers can help, where I feel the Reiki people can help, is these are people who can help to deal with the stress, and we need to educate them. We need to help them differentiate between stress, distress, depression, and we need to educate them about mental health disorders, because whether we like it or not, they are the first contact. Now, of course, this first contact may not be the best contact, because what we have also seen, we have seen physical abuse, we have seen sexual abuse when people go to these so-called healers. Now, but what happens is the reality is that every person who has come to see me, I mean, every person may be an exaggeration, but I would say that all the mental health professionals who are here, people who come to see us, have visited either a faith healer, have visited a Reiki specialist, have visited someone who is trying to remove black magic from them. So if they can be educated about mental health, I think we will gather some momentum. Of course, as Manoj was saying, we need to standardize cares. When people come to me, they say that, oh, we do not want medication, because there's so much stigma about medication. Because what happens is, when a psychiatrist prescribes a medication, the first person the people will go to is the chemist, who has his own issues about mental health, who will probably tell the person that, oh, why are you taking this medicine? this is a sleeping pill, you will get addicted to it. So as it is, the patient goes through so much fear and he says, oh my god, what is this medicine? Then he will meet his family doctor, who has his or her perception about taking medication. Then, not to count the countless relatives who come, who will say, oh, let's not do this, go here, go there. Now what happens is that because of that, a lot of time is lost, a lot of confusion already. The person is already confused, and you're adding to his confusion, and the treatment gets delayed. Now, to the other hand, of course, there are people in my field who may over prescribe medication. So to have the right balance, between counseling and medication, to understand that each person has their role. What I've been doing with the different spiritual circles that I work with is, or the different support groups that I work with, is that once we identify, yes, we try not to over medicate, we explain the need for medication to people, and then we send them back to the same support group. Now, what happens is that when we work together, I think that is the way forward. I can't take care of my country alone. I can't take care of the whole world alone. Everyone has a role. My psychologists have a fantastic role to play, and so does the support group.
Yeah, that's a very, very good point. I think that doctors and clinicians are not gods. We're also
Absolutely.
human, and we also deal with our own mental health. And so it's very important for us to think about all these avenues of treatment. It's one thing to treat the individual, but they need to be tapped into social support. It's one of the key indicators of long-term healing and prognosis in a positive direction. And so thank you so much for the work you do and actually creating that level of collaboration. Pragya and Havovi, I want to hand the same question to you. Maybe defining a little bit technically, actually, too, the role of a psychologist versus a coach versus a psychiatrist. I know it seems obvious to us here, but for the majority of people, it's quite confusing.
No. So I guess we could start with, I'll take two and Pragya can take two. Um, a psychiatrist, as we know, and I think everybody else also needs to know, is that somebody who knows the physiology, does understand the mind, but primarily you go to for medication. And there are quite a few psychiatrists over there who are qualified to even give therapy, but I think that's again very subjective. We find, I mean, at least I know very few psychiatrists out there who are actually involved with psychotherapy. Um, when it comes to being a therapist, I am going to basically focus on your healing more than anything else, your mental health healing. And this is basically looking at certain obstacles that you've been facing, certain issues you've been facing behaviorally, cognitively. How can I help you with my dialogue, with the process of therapy to overcome these particular issues, to lift these particular roadblocks? It's more to do with the internal processes of a person than to do with the external processes of a person. So that's your distinguish between a therapist and a psychiatrist. And I just want to put it out there that, Dr. Anjali's put this really, really well, that working together is really, really important. We come from a background, from a culture also, where the first point of contact is a healer. And we can't sort of say, putting that aside. In fact, in America, I remember I have an aunt who had breast cancer, and she had a team of 19 doctors taking care of her, right from her physical health to her mental health to her spiritual health. And she came out fighting. And that's really, really important. And it's very important for each one to know uh, what each one can do for this person. It's not about you, it's about what you're giving to the client, to the patient at hand, which we have to remember. That's the priority over there. So, over to Pragya.
Okay. I think I'll take up from where Havovi left, coming to who is a psychologist. I think a psychologist, especially I think in India, is a clinical psychologist who does psychological testing as well as provides psychotherapy as well. Whereas I think a clinical psychologist has a very specific role outside India. I think there are some countries that define clinical psychologists only to be doing psychological testing. However, I think in India, like I said, that a clinical psychologist does both that psychological testing as well as providing psychotherapy. Coming to a life coach is basically a wellness trainer, is a person who's there more like a supportive counselor and more also there to outrightly suggest, give solutions, and provide for constant support. Versus a mental health professional, which could either be a psychiatrist, a counseling psychologist, or a counselor, or a clinical psychologist, are people who are there. Usually, they are people, I think, more at the clinic, at the hospital, and people go and visit them in intermittent time spaces. Whereas the coach is someone who is, I think, more through with the person. And the focus is more on wellness, the focus is more on well-being, versus I think the three mental health professionals that I just mentioned, they don't just work on prevention, but they also work on intervention. That is, when there is any kind of psychological distress or psychopathology, they also look at treating that either through medication or psychotherapy. And I think since Dr. Chabria and Havovi have already, like, emphasized, I'd just like to close by re-emphasizing that 99% of people in the world believe in some sort of spirituality and religion beliefs. And I think it's very important for us as mental health professionals to respect and accept that people who have beliefs in either of spirituality or religion also works for them. And I think just re-emphasizing the fact that a reintegration and working in liaison is very important, because at the end of it, we're all looking at the well-being of our patients. So I think that's where I'll stop.
Thank you so much, Pragya. And I think that that last point you made is so important for us to recognize. Um, I spirituality is such a broad definition too, and I think typically, traditionally, we used to think of religion, but spirituality is much broader, and we need to be more accepting of that and its role, because it has such a positive role. Um, Manoj, I want to come to you a little bit here, because I think that now that we have a general landscape and definition of these different roles of treatment providers in the space, you speak a lot generally about peer support and the bystander and what their role is. When someone is quote unquote a bystander or a peer, what are some of the things that they can do to help a loved one or a coworker or a friend who needs help, but trying to help them navigate where to go and who to go to?
Sure, Raghu. This is one of the biggest learning we've had in our discussions with those with mental health issues and their caregivers. Because essentially, if you look at the journey of a person with mental health issues, it is about decision making. I get up in the morning, I find something wrong with me. I need to make decisions. What decisions I make are based on several things, several factors. It certainly is about how I view of the symptoms, how I view about mental illness and mental health. But more importantly here, irrespective, in most cases of mental health issue, it is also, in fact, more powerful. It is about the views people around me carry. And they could be family members, they could be my friends, peers at workplaces and other places. Now, what is the view that they carry about mental health in general and attitude they have about those with mental health issues will influence a lot on the decision I make about my problem. Now you can see the power they wield. So now let me shift to me as a possible bystander or a caregiver, a family member who now sees somebody within my vicinity having a problem. Do I know that I have the power? Do I know that I have a view? And do I know that I may not necessarily have a very positive view of the problem that the person is experiencing? If I knew, then that will be the first point of decision making I will make, that I must build the right perspective to mental illness and mental health. Let me understand that I can be a bystander, but I can still be an ally. I must have the right knowledge about mental health. I must unlearn a lot of what I have been told about what mental health is and what people with mental health issues are about. The moment I have knowledge, this is an interesting thing we have seen. The moment I have the right knowledge, my empathy begins to come out. Usually we will see all of us having empathy. But in the case of mental health issues, and this is something we always can really observe, empathy does not get demonstrated because I don't know what to do. To the same co-worker who may have a physical disability temporarily, I will go do everything possible for that person should that person come to office. But if the person is demonstrating emotional distress, I don't know what to do, and therefore I'm not able to show up my empathy towards the person. So the moment I have the right information, I know I can be an ally, I will be empathetic to the person. And the moment empathy comes in, I know how to communicate. This is the next thing that I should do. How do I communicate with the person? How am I communicating which is objective in a sense? I'm not being subjective. I'm not being preachy. I'm not providing suggestions to them. And I know if I do that, what is the repercussion? Because I know what is my role here and what is the objective of the decision I make towards being a bystander. I will stay with them. I'll inquire about their health, and I begin to make sure that I'm slowly helping them make decision to reach out to a professional. Because I know how difficult it is for a person with mental health issue to finally say that I'm going to be in front of a mental health professional, and I'm going to really help them towards that. If I'm able to really help them in this kind of a decision making, that's one of the first and most important pivotal element I could really role I could play in being a bystander or a peer support person, I would say.
Thank you. Yeah, thank you, Manoj, for bringing that up. And you brought up the concept of empathy, which is, very important. And I think that what the vision is that I have is how do we create a community and an environment and society that starts to feel the empathy again. Everyone is born with empathy. This is my belief. Everyone is born with empathy, but the journey of life and the traumas that one has maybe gone through starts to suppress that empathy. And so how do we bring it back? And you mentioned education. I think this is the common theme, is education is power. Literacy is power. I want to come to Dr. Anjali on this a little bit as well, is now, what are the signs for one to look for as an ally, like Manoj mentioned? What should allies defined as family member, neighbor, loved one be looking for when someone needs help? And we have a interesting question that came in as well that's more specific. One of our viewers, they want to know, someone suffering from depression, for example, who should they consult? So maybe we can try to incorporate that in as well.
Right. So, for example, I think I just want to add on to what Manoj was saying is, I think all of us in our own little way have been trying to educate people around. Okay. And I have tried different innovative ways. For example, I had one program on dance and depression. Since last year, I have kind of worked with people in different fields, including a stand-up comedian. Okay, and we've been going to, who happens to be my younger brother, but we've been going to different colleges and educating teenagers as to how they should pick up science, because as we all know that the highest number of suicides is amongst people who are young. So now, what are the things that we do when we see, how do we identify signs? So the first thing we need to remember is either changes in behavior. changes in sleep, changes in appetite, or anything irrational that comes up. What do we do? So if we see sudden changes in mood, so if you have a teenager who is sleeping erratically, who is behaving erratically, has mood swings, or anyone for that matter, whether it's your husband, your wife, your neighbor, your father, your school teacher, who suddenly starts either reacting excessively or stops reacting. So for example, withdraws from WhatsApp chats, gets very angry, okay, or gets very moody, does not want to be in any conversation, or wants to be the center of a party whether it's required or not. Now these are changes in behavior. Changes in mood: I'm angry all the time, I'm upset all the time, I'm crying all the time. And especially this is true of lockdown, because we are seeing these erratic mood changes all around us. Sleep and appetite. I either sleep the entire day or I don't sleep at all. Now, these are some of the signs that we may see even at workplace, where we see that people do not want to work, or are extremely anxious. Now, as Manoj said, that, the fracture of the leg can be seen very easily, but the fracture of the mind cannot be seen very easily. Now, if the good part is that, yes, there's a lot of education happening already. Now, we need the sensitivity to come, we need the knowledge to know what to do when we see someone around us who is in depression. How do we react to them? And because of lack of knowledge, we do not react. So, what I would like to say here is, the next time you see someone behaving erratically, don't withdraw away. In fact, reach out to that person, even when the party is over, even when everyone else has gone. And just, I know we cannot physically touch, but just reach out to them and ask them what's up, what's happening to you. I'm worried about you and I want to help you. One thing you do not do is gossip about these people. Understand what is happening. The second thing you don't do is give them gyan. We all love to give gyan and say, oh, go for a holiday, it'll all settle down. Even so and so went through it. Everything is okay. Please, you do not know what the other person is going through. So do not judge them. Do not give unwanted advice. In fact, just lend your shoulder and understand what is happening to the person. Now, what I always like is a top down approach. If someone is going through depression, the depression could be because of certain changes in the brain, could be because of certain circuits which are not working properly. So I prefer, like even at Mind Temple, I first see the person to understand whether the person needs just supportive counseling or whether they need medication. If they need, and many a times what we see is that they need both. So I feel it's better, because sometimes if people may spend a lot of time in counseling, and if someone is suicidal, we don't want someone to take that leap. So I'd rather put the person on a little bit of medication and enhance it with the counseling or the therapy that they need.
Yeah, thank you for sharing that. A few things really jumped out to me, which is I often am faced with folks who think psychiatrists, they think medication. And I try to describe that there's a role for everything. And sometimes you might have depression to the point where you can't even get out of bed to get to counseling or to get to your meditation or to get to work. And so we build you a bridge with medication to get you off the island, to come back. And so I think that we want to demystify this stigma and this, this black box that's built around this field of psychiatry. Psychiatrists are also human, so we're there with you. The other point you mentioned is checking in on folks, not withdrawing. And one of my favorite quotes, it's actually the background of my cell phone, is by Krishnamurti, which says, the ability to observe without evaluating is the highest form of intelligence. And so when we think about the therapist-therapeutic relationship, this is something everyone can do. It's this ability to actively listen without interruptions, but with intent. And so that's very powerful. To ask, how are you doing? And then someone says, fine, and you go on with your day, that's very different. But to actually give space for silence for the answer to come out is very powerful. And so, Pragya, it seems like you might want to add something to this as well.
I think yes, taking forward what Dr. Chabria and you just said, I think I would like to go a step ahead and actually say that we as mental health professionals, especially because I'm also a clinical psychologist, I'd like to really support and advocate for the idea that we have to, as like a professional field, also be very open to understanding that medication and therapy are like hand in gloves. They go together, and a lot of times I think this is something that I say out of my experience, little bit of experience, that we as professionals also need to become more open to the idea of accepting medication. And I remember one of my mentors making this statement that medication actually works like magic. It can change people's lives. And I think, like how I stated last time, that I think the patient well being has to be the criteria which we keep in mind and work towards. So I think that's what I'd say, and just add to what Dr. Chabria and you just said. So, yeah.
Yeah, thank you for that. Havovi, would you like to add anything else to this?
I think summing it all up, the one of the things that I've seen is that when sort of either psychiatrists are in training or therapists are in training, we don't know the gravity, or we don't know how much we can make a difference, how much the other person can make a difference when we become allies. Group work is not taught that much. Teamwork is not taught that much. So the whole impression of holistic is gone. Everyone's like, okay, I'm going to be able to help this person on my own with, let's say therapy, not understanding that, there's an internal process that needs to be fixed with medication. It's like a car, right? If there's a problem on the inside, you have to go on the inside and fix it. You can't buff it on the outside and be like, hey, now it's fixed. So it's very important to know what each one can do and how each one can help you and make, like we've been saying, make it better for the patient. At the end of the day, it's about the patient, the client at hand. And it's not about you and what you can do only. So we need to sort of get out of these boxes too. Like, I know a lot of professionals who sometimes don't give referrals because it's about them. And they don't understand that it's not about them, it's about the patient. So if it's not in your periphery, please go ahead, give a referral. It's okay. It's the right thing to do. And there is no shame in that. It doesn't make you less of a professional. It makes you a more mindful professional, if anything else. And at this point, again, I would say when people are in the process of healing or taking care of themselves, do what works for you. If praying works for you, fine, go ahead and pray. If that makes a difference to your life, go ahead. If going to a temple or going to a Reiki healer, if all those things help you, why not? Why not? The problem comes when you make it your be all and end all. So understand what you are doing and its limitations, and how it can help you and how it can also be a blocker for you.
I love that. I think some of the themes that came up, which we're scrolling down, we noticed that the education leads to empowerment, right? We're coming across this repeatedly.
Yes.
Collaboration is key to treating each individual. Dr. Anjali mentioned this in the beginning. You re-emphasized it now. And the end goal is the patient at hand. That's what we always have to think about, is
Yes.
how do we dissolve our egos to actively listen and to actively intentionally collaborate with one another. And I think unfortunately Manoj dropped off here. I think hopefully he'll be back on. And I know we're nearing time a bit. So I personally did learn quite a bit from this discussion. And I think that it is hopefully informative to demystify the space of psychiatry and psychology and mental health, and that there's a wide world of treatment options, which Havovi, you kind of summed up. And if a Reiki healer helps, go to it. But to stay open-minded and to know that as an ally, when someone is in distress or in crisis, how to approach them and how to take them to actually get treatment. Now, how do we, Manoj mentioned the supply and demand concept earlier. So how do we actually make help-seeking behavior more acceptable right now? Maybe Dr. Anjali, if you'd like to start.
So I think that journey has already begun. A lot of professionals are working towards reducing the stigma, to educating people. And the best part is that people are working together. So I think, of course, I would definitely want not only our Indian government, but governments all across the world, just that they have the way they have looked after physical health in the last 6 months. I think the next 1 year, if they take over mental health, I think we'll be there. If we could eradicate polio, we must also try and working towards positive mental health. We must go ahead with collaborating with people so that referrals become easier and people can work together. So I think the journey has already begun. Now it's about multiplying efforts by coming together, and using each and every way that we can, whether it is media, whether it is education, schools, colleges, etc.
Yeah, thank you for that. I think it's, again, yeah, we all have to collaborate. Everyone has a role in this, in making this change. So very beautifully put. I want to pose the same question to everyone else on the panel as well. So maybe Havovi, you'd like to take this. Is how do we create a world in which one can seek help without feeling shame? How do we make that behavior more acceptable?
I think it starts at home. I genuinely believe it starts at home. Um, I actually wanted to end on this note, but I'm just going to say it now that I think mental health needs to start becoming a living room conversation. And it's not something that should be hidden behind closed doors in the corner of a room where you feel shame and you feel guilt. And that is also a big role our caregivers play. Today, if we are able to be professionals in this particular field, it is also because of where we come from and our understanding of people and our understanding of emotions and how we've grown. So, for me, I think it starts with your caregivers, and just by your caregivers, it doesn't have to just be family. It could be really, really good friends, close friends. How people think about it matters a lot, matters a lot, right? So when I am in company that says, you know what, there's no shame, I'm here for you, you know what, there's only that much I can do as a friend, you probably need a little more help, and I'm here to support you through it. uh, Go out there, find out. Just going back to the previous question of how to be there for someone. Empathy. Listen. Don't devalue or undervalue someone's statements and someone's emotions. That this is a phase and you'll get out of it, and it's happened to other people. And the whole thing of downplaying it, right? It's a phase. It could not be a phase. What about that? Do you know enough to actually claim that it is a phase? So it's important where you are and who you are with, and that plays a very, very big role. Our environment plays a huge role in how we grow up and how we think, right? When we're born, we're tabula rasa, we're a clean slate, and we pick up from the environment. We're continuously picking up from the environment, and that really, really matters who you are surrounded by. So I think it is also the responsibility, along with the education system, is the caregivers, the people at home, and the people that you surround yourself with.
Thank you for that. You're 110% correct. It is the environment. It is the genetics. It's primarily the environment, and it's also the energy that we're surrounded in, and how that it becomes and can be supportive. And you mentioned a lot about the caregiver, so I want to go to Manoj with the same question. Just very quickly, what is something that we can do to create help-seeking behavior be more acceptable?
So, Raghu, what we have seen in our conversation is we are seeking essentially a mindset shift on mental health and mental illness, and attitude towards those with mental health issues. Mindset shift cannot happen automatically. It requires all that Havovi was pointing out. What will empathy come in? Empathy will come in only when we don't really go with a stereotypical view or definition of anything, actually. And we don't have our own rigid forms of anything. Because if we say this is the normal and anything out of this is not accepted, then I'm not going to demonstrate empathy. I will not be empathetic to the person. So being self-aware of our notions, bringing in course corrections, unlearning those aspects, all that requires education. And education is not just literacy. And we've seen that. And which is why we found far easier to, with due respect to seniors in the community, I can tell you that it's easier for me to speak about mental health to youngsters, because they come with less baggage, and they say, okay, this is interesting. I don't want to accept what has been told to me about madness or mental illness. Tell me a new way to look at it. And they accept that. So education, like how we pointed out, may require to begin in the family first, in the closed rooms of the comfort of the family, where we are open to speak about it and get people to understand that this is not a rigid view that we will carry. And then we will begin to be the allies, be the caregivers, be a bystander who is playing a very constructive role towards creating an environment. Essentially, it is about creating a social environment where the person with mental health issue knows that I can open up and speak without expecting an adverse reaction from the members of the community. So that is what we need to aspire to achieve in mental health care.
Yeah, thank you so much, Manoj. I think you're 100% right as well. I mean, these are all great points. Pragya, we'll end this question with you.
I think my co-panelists have been amazing, but I think they've very holistically summed up everything that's required here. And I've just ended on a note that I think self-awareness and self-acceptance are key. Like how Havovi said, it starts at home. I think I'd go a step ahead and I'd say it starts with you. So I think there is a need for all of us to not just become self-aware, but also go to the next level of self-acceptance, because I think something that we all see in our practice is there's so much of struggle in accepting where we are. There's so much of struggle in sort of making peace and acceptance with our vulnerabilities. I think I'd like to quote Brené Brown here. She says that vulnerability, though, is a place where you feel weak and exposed. It also is a place where you also gain your strength, power of joy and creativity as well. So I think that's where I'll sum it at, that self-awareness and self-acceptance, the journey begins with you.
I love that. And, that's sort of the messaging that we all have. And even when we work with our patients or clients, it's to help them achieve that level with themselves. And so all very beautifully said. I think there's some very strong key takeaways here, right? I will say it again, education is the key to empowerment here, to empower people to support one another. Empathy comes back time and time again. There must be a reason. It's very critical to all of this journey and how we change societal perceptions, that mind shift, which Manoj mentioned. Dr. Anjali, you spoke quite a bit about folks who go through the system, multiple providers, healers, and why is it that they go through the system? Is it because people are not collaborating as much as they should be? And I think that what this panel really highlights is that the providers on here were collaborating with folks like Manoj, and we're trying to work together. We're trying to work with spiritual leaders and really creating that environment. So that's the shift that needs to continue to happen. And so, I think my takeaway here is I hope that we're able to demystify a bit what it is to seek treatment, and that it's okay to seek treatment, how to help one another, what to look for. And also that, we all have mental health, and that we might need a little bit of help at some point in our life. And it's okay to do that. And it's okay to ask for help and to help each other. And so I want to leave folks with the one thing, which is that what you can do to create this mind shift change and to support one another is simply to just check in and to reach out to someone who maybe you haven't spoken to in some time. Maybe it's a family member, maybe it's a friend or a neighbor. We're in unprecedented times, but regardless of that, that's a simple thing that each and every one of us can do. And with that, we create a world in which anyone, regardless of where they are, will feel a little bit more okay asking for help and seeking help. Um, so on that note, I also want to push a little plug that the next panel for Danotsav Week is actually focused on your mental hygiene and self-care on Thursday, October 8th at 10 a.m. India time. So folks can tune in there as well. But thank you so much to Havovi, Pragya, Dr. Anjali, Manoj for taking the time out of your busy schedules, especially as World Mental Health Day is around the corner. And I know many of our patients really need us now. So thanks for taking the time and for all the work that you're doing. And hopefully all of us take care of ourselves as well. So thank you.
Thank you. Thank you.
Thanks, Raghu.
Thank you so much.